All right, so I'm your stretch ninja. I'm going to tell you a little story. I think I'm going to run myself out of business here. Stretching is sometimes, I think, overused. All right, I think we put so much credence into stretching. Stretch, 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 stretch. I know this is horrible for me to say as a stretch ninja physical therapist, but the fact is we stretch, I think, things a little bit too much sometimes. I think oftentimes we confuse things as far as stretching like a sore muscle or a stiff muscle, when in actuality we may want to strengthen that muscle. That muscle actually is probably fatigued, it's overworking. It needs actually to be strengthened. We stretch it more, we're probably going to irritate it. So when I have my patients in here and I see them and I say, listen, you've got good range of motion here, good range of motion here, as long as it meets their needs, it's fine. If we have someone that's a ballerina, we have gymnast, they have extraordinary needs for range of motion. They're very different from my runners and my walkers. So sometimes someone, they'll come to me, they'll say, I'm a runner, I stretch all the time, I just can't seem, the hamstrings are always tight to me. Let's rethink this. This may actually be an issue where this muscle is actually too stretched. It can't generate enough force. In actuality, that soreness and stiffness, that is actually a sign of not to stretch it, is actually to get it stronger. Why not? And if my runners are coming here, or I've used runners as an example, they're saying, I have this chronic stiffness in my hamstrings. Well, if you've been stretching it, and hopefully you've been stretching it right, why don't we try something different? Why don't we go ahead and try something novel and strengthen it? Especially for those folks that are doing, like our runners. Sometimes our runners, they love running, they do a lot of running, they do a little flexibility, and then they do a lot of their running. They'll do their speed work, they'll do the long, slow runs, the middle distance runs, tempo runs, never do any strengthening. Maybe that's the missing component, especially if, I use hamstrings and I use runners as an example. Maybe they don't need to put their leg over their head. What range of motion do they need that for running, unless you're doing hurdles? If you're doing a 5K and move along, you need a certain degree of range of motion. But probably, once you have it, why don't we maintain it? Let's go by the needs of the individual. Do we want to do a stretch like this? You see any runners stretching like this, running like this? Do they need this wide range of motion? Probably not. They probably, maybe if anything, they've shown if you stretch too much and too much flexibility, it actually decreases. We want some of those muscles to be rigid. Too much range of motion, and almost like the muscles have to work a little harder to maintain everything together, almost like you're too loose. There's a syndrome named Ehlers-Danlos syndrome. And these are people, unfortunately, I'll just use this as an example, that have really loose tissues. They dislocate. They'll dislocate shoulders for very mild things you never think they would get dislocations. And they actually, all we do is strengthen them. We never stretch them. We want them strong, okay? I use that as an extreme example, but let's think at us. If we have enough range of motion for our activity and what we need to do, maybe work on a little bit of strength. So I think some of these things are mixed signals. Also realize, we had talked about this before, stretching prior to activity, they're seeing actually creates, which I thought it was irritating the muscle bellies, which, stretching is a form almost of micro tearing, we're elongating this tissue. But they show that it actually irritates the nerves, it changes the signal in the nerves, so the muscle doesn't activate as quickly and we don't get the same feedback to the brain. So these are some things that, let's kind of rethink this. Let's stop stretching for a minute, that really sore muscle. Let's change it. Let's go ahead and let's get it a little stronger. Let's see what that is. Now I know it's hard for someone that's a lay person, maybe they don't know what's tight. But, I gotta say, we have some of these runners that come in here, I got calves that are stiff, hamstrings, they've got incredible flexibility. They don't do any strengthening. Some of them don't. Let's rule that out and see if we can get a little strength in there, help them out. Let's see if that's the difference in their recovery and how they feel better. Maybe that's really the key component that we're missing. So, once we get what I consider normal range of motion, you can see a therapist, they can explain, they can see what do you need for your activity. But maybe we need to strengthen and rethink that whole model. There are exceptions to it. If you're coming after surgery and you need certain range of motion to get to normal limits, yes, we're we're getting through scar tissue, we're trying to regain range of motion. After certain muscular injuries, we may have a shortening of the tissues, and we need to increase the range. But once we've reached that range, let's rethink that. Maybe we have to change. Maybe that soreness we're feeling, whether it be lower back, hamstrings, calves, maybe it's really not related to lack of flexibility or stiffness. It's actually related to lack of strength. Think about that. Muscles, it can't quite secure it and stabilize, and because it's asked to do it You know, it just doesn't have adequate strength to stabilize your, you know, your pelvic girdle or your lower back. So think about that today on Friday. And if you're stretching, stop stretching. Maybe you need some strengthening. Okay. I hope it helps you out. Be well.